In the middle of desperation, another potential crisis may be brewing.
This is not a small place, it's the whole island. And the problem with the diesel and the gasoline, we are trying to work with these people. We are trying to still providing services to these people.
Dr. Maria Rodriguez has worked at this community health clinic for 24 years. It's one of 70 such places all across the island which serve as the front line for preventive health care. Everything from broken bones to counseling to pharmacy services for many Puerto Ricans. But as fuel dwindles, so will care.
In a way that if we continue to provide these services in this area, we stop the patients go to the hospital that is already overcrowded.
They have been told that they have just 6 hours of fuel left. And at that point, without any help, they will have to close their doors.
What else we can do? The only thing we can do is go into the shelter, do the medical evaluation, but we can't provide medications to those patients.
And that's in part why you're seeing tents like this pop up in places like San Juan. You see, even before Maria, a third of the population here was reported to be in poor health. They're more likely to be older here, more likely to have chronic disease like hypertension and diabetes. And therein lies the concern. What happens to all these patients if they don't get access to care within the next several days? Getting healthcare services up and running is key, but the only way to do that is to make sure clinics like this are powered with fuel. And right now, that's a big unknown. Domingo Cruz, director of San Jorge Pediatric Hospital, knows just how critical it can be. Just 2 days ago,
the hospital was dark, and all of a sudden, as you may understand, everybody was very nervous, and we started evaluating transfers, possible transfer to other hospitals, patients that could have been discharged home earlier than what it was initially perceived.
They were running low on fuel, just 2 days worth, and a dozen children on ventilators.
We were ready to evacuate the entire hospital if we didn't get power somehow early afternoon.
A neighboring hospital brought 1,200 gallons of fuel. And then yesterday, a U.S. Army tank provided 3 more days worth to keep this generator going.
It was a close call, and we thank God that it worked out.
It's been trying professionally as well as personally. In the midst of the storm, his mother passed away.
Very hurt the day of the storm. The day after the storm, I showed up. We need to be open. There are people looking for us.